Hi, everyone. Welcome to the webinar. We're just going to give it a few moments for people to join and then we'll begin. Let's go ahead and get started. Welcome, everyone, to today's webinar. My name is Mandy Sandquiller and I'm your Director of Partnerships and Communications. And it's my absolute pleasure to be here and to introduce our webinar that will talk about heart failure, congestion, and then some tips for staying healthy over the holidays. And before I introduce our speakers, I just wanted to remind everyone that you are in listen-only mode. So you will not be able to answer questions that are related to your specific condition, but we do encourage you to take those questions back to your healthcare providers. Please type your questions into the Q&A box so that we can answer them at the end of the presentation. There'll be lots of time for questions. And then a note that webinar is being recorded and will be available on our website and our YouTube channel in the next day or two. And we also wanted to thank our sponsor on this webinar, scPharmaceuticals. Without their support, this education would not be possible. And now I would like to introduce our two speakers tonight. First, we have Amanda Edgar, who's a heart failure nurse practitioner, joining us from Mississippi. She'll open up the webinar tonight talking about heart failure and congestion, and then giving us some of her tips as a clinician for a heart healthy holiday season. And then we'll be joined by Carole, who's going to share her story as an expert patient advocate. She has some excellent tips for managing heart failure and fluid. And so now I'm going to turn it over to Amanda. And Amanda, please take it away.
All right. So my name is Amanda Edgar.
Amanda, I'm sorry
I
to
am a family nurse practitioner and I work. Oh, that's okay.
we're just getting a bit of the static from your storm, so maybe it's best to go off camera for right now.
Okay, gotcha.
Thank you.
Okay. Hopefully that will be better. I am a family nurse practitioner working in Mississippi, and I work in a cardiology clinic seeing the heart failure patients there.
Are you still there, Amanda?
I am. Are you able to hear me?
Yes, we are. I'll go ahead
Okay.
and turn the next slide.
Okay, that sounds good. Okay, that's just a little on my background. I've been working in this heart failure clinic for about 6 years, and prior to that, I was a nurse on a cardiology floor. And I just wanted to kind of start by defining what heart failure is. It is a very common condition. It affects more than 6 million Americans, and it is the leading cause of hospitalization in adults over 65 years of age. Basically, it means the heart is not filling or pumping as it should be, and there is no true cure, but it can be managed very well with medications, diet, and lifestyle changes. So CHF, congestive heart failure, is a condition that develops when the heart doesn't pump enough oxygen-rich blood for the body's needs. It can affect the left side, the right side, or both sides of the heart, though the left side is the most commonly affected side we see, and that is the side of the heart responsible for pumping blood to the body. Diagnosis of heart failure is usually done by a heart ultrasound, also called an echocardiogram, and we look at the ejection fraction. That's a measurement of the ability of the left side of the heart to pump. So you may hear terminology like heart failure with reduced or heart failure with preserved ejection fraction, which would be greater than 50%. And then sometimes a blood test called a BNP may be performed. That can help us get to the diagnosis of heart failure, and it can also help us tell if a treatment is working if those BNP levels start coming down. There we go. So the number one cause of heart failure is coronary artery disease, which is a blockage or narrowing of the arteries that supply blood to the heart. Also, uncontrolled high blood pressure, aging, genetics, and family history can contribute. Unhealthy lifestyle factors like smoking, heavy alcohol use, poor diet, physical inactivity, and obesity are some causes. Cancer treatment like chemotherapy and radiation can cause the heart muscle to be weak. Atrial fibrillation, which is an irregular heart rhythm, can cause heart failure. And then some other chronic health conditions like diabetes, kidney disease, anemia, those can increase the risk of developing heart failure. Symptoms of heart failure are mainly going to be called congestive symptoms, and that's where you see swelling in your feet, ankles, or abdomen. Shortness of breath can occur at any time, but most people notice it more with activity. A cough or difficulty breathing when reclined or trying to lay down. Chest pain, nausea and loss of appetite. Heart palpitations, like a sensation of skipping, racing, or fluttering, dizziness or fainting. And then with heart failure monitoring, you want to follow the rule of threes, which would be a 3-pound weight gain in 3 days. That's a fairly rapid weight gain. So that would be more indicative of heart failure or fluid than actual weight gain. So one of the main treatments behind heart failure is just managing that congestion, because that's going to occur very commonly. So you want to make sure you take your medications consistently and not miss any doses. Usually we have our patients follow a low sodium diet. That is somewhere between 1,500 to 2,000 milligrams of sodium a day. And then a fluid restriction of no more than 2 liters or 64 ounces in a day. Avoiding alcohol. And then you want to closely monitor for symptoms. So you want to monitor your daily weight, blood pressure, heart rate, and then take your fluid medications as prescribed as well. Some of the commonly prescribed fluid medications are going to be the loop diuretics. That would be Lasix, torsemide, Bumex. Sometimes we'll also use a thiazide diuretic like hydrochlorothiazide or Zeroxylin, and a potassium-sparing diuretic like spironolactone. And then when fluid gets to be a little bit too much and the medications by mouth aren't working, that's where we bring in other treatment options like IV Lasix or subcutaneous Lasix. The subcutaneous Lasix is called Furosix. That's the brand name of it. And I do use a good bit of this in my clinic. It's an injectable Lasix that goes into the subcutaneous tissue. So that would be on the abdomen, like where a diabetes insulin injection would go, around that area. It comes in a kit, and each dose is 80 milligrams, and it's worn for 5 hours. And it is as effective as the intravenous Lasix of the same dose. The good thing about it is it's portable. You can take it with you. It's shelf stable for 2 years. It does require a prescription, so you can't get it over the counter, and it's usually filled by a specialty pharmacy and mailed to the patient's home. And patients can administer it themselves at home, so you don't have to come into the clinic. You don't have to have a nurse or a provider do it for you. And this is just what those kits look like, where it has the vial of Lasix that's placed in that top part. And that infusion device is what you wear on your abdomen for 5 hours. It comes with a skin prep pad and instructions, and the instructions have pictures on how to administer it. So the holidays are one of the times when we see an increase in heart failure hospitalizations and complications. So I just wanted to go over some tips to hopefully prevent that from happening. So on the things you want to do, that would be stick to your routine, try to get regular exercise, stay hydrated, take your medications on a schedule, and then monitor for those symptoms. The weight gain, especially rapid, is a sign of fluid, worsening shortness of breath, swelling, palpitations, or chest pain. You want to try to stick to the heart failure diet, which is that low sodium fluid restriction, and then have a plan if you do develop worsening symptoms. And for don'ts, you definitely don't want to ignore symptoms. Heart failure can rapidly get worse, so you want to try to catch symptoms at their earliest so you can treat them. You want to avoid extreme temperatures and altitude. High altitudes have less oxygen in the air, so they can affect a heart failure patient more significantly. And then don't overeat or drink excess alcohol, because those things can worsen heart failure too. If you're going out of town, a good idea of things to pack would be your blood pressure monitor and a scale, your medication list, and your doctor's contact information. You want to have your prescription medications on hand. And then if you do have a pacemaker or defibrillator, you want to be sure to bring the identification card with you. One of the potential complications of overeating and alcohol intake over the holidays is called holiday heart syndrome. And that is an irregular heart rhythm or a rapid heart rate that causes sudden shortness of breath, chest pain, palpitations. This is basically due to vagal nerve stimulation when you overeat or intake too much alcohol, and that's going to cause the heart rate and the blood pressure to elevate. But some contributing factors to that are lack of sleep, caffeine intake, and stress, all of which are more common around the holidays. And if it lasts more than a few minutes, it is recommended to seek medical attention. Those symptoms usually resolve within 24 hours. Most patients will need to be hospitalized. So you want to have a plan to try to stick to your diet over the holidays. Good things to follow is avoiding processed meats. Don't add any salt with a salt shaker. And then be careful with packaged and canned foods. So fresh food is always going to be the lowest sodium option. If you can't go with fresh, frozen is the next best. And then canned and packaged usually has the most sodium. Now, if you do have to cook or eat something canned, it's best if you wash it first. That will get some of the sodium off. And then if you're going over to someone else's house, if you can prepare some of your own dishes and sides, that way you have something that you know you can eat that's low sodium, that's a good option. You want to avoid overeating and limit alcohol intake as much as possible. And there are hidden salt in food. That's mainly going to be the packaged, pre-made things, canned soups, canned vegetables, but also any pickled foods, olives, cured meats. And then some of the seasonings you have to be careful with would be lemon pepper, garlic salt, MSG, meat tenderizer, bouillon cubes. Some of those don't specifically say salt in the name, but they do contain sodium. And then condiments too, with ketchup, steak sauce, mustard, and soy sauce. Those are all pretty high in sodium. And I like to always show this nutrition label when I'm talking to my patients about sodium, because you not only want to look at the sodium content of the food, but you want to look at the serving size. Like on this, you can see a serving size is half a cup, but there's 3.5 servings per container. So if you are going to eat the whole container, you have to triple that sodium level. And you can substitute to make things lower sodium. So lean meat instead of red meat is already going to be lower sodium. Pork is the highest sodium meat you can have, but fish, chicken, and turkey are lower sodium. You can use Mrs. Dash or no salt seasoning instead of adding salt. And you can season with pepper, garlic, and onions. For meat marinades, you can use orange juice or pineapple juice. Substitute club soda in beverages instead of alcohol. And then you can cook with vegetable oil in place of butter, or you can get low salt or no salt butter. And then baking, steaming, and grilling is going to be more heart healthy than frying foods. And if you go out to eat over the holidays, just know most restaurants are cooking with a good bit of sodium, so you have to be careful with the items that you pick on the menu. You want to avoid pickled ingredients, anything with soy sauce added. Limit the condiments and ask for salad dressings and sauces on the side so you can just add a little bit instead of a lot. Some places will offer a low sodium menu or tell you which options are lower sodium. And you can request the meal is prepared without salt. And if you do that, a good idea is to take your own sodium-free seasoning with you so that you can add something without having to add salt from the table. And if you do end up having some symptoms of congestive heart failure or fluid, it's always good to have a plan. Usually this will be done with your doctor if you talk to them before you travel. Some of the options we use in my clinic would be taking an extra fluid pill, like an extra Lasix based on a weight gain or symptoms. Sometimes we'll use Zeroxylin. We call it a booster pill because it'll help your other diuretic work a little more effectively. And then, of course, we use that injectable Lasix, the Furosix. And then I also give my patients this, usually on their first visit. This zone tool just kind of tells you where you fall with your symptoms. If you're in the green on here, which would be no shortness of breath, no rapid weight gain, no swelling, no chest pain, that's where you want to be. You're at goal with your symptoms and there's no need to report anything or do anything. If you start to get to the yellow, that's just the warning zone where things are starting to get a little bit worse. You may notice more shortness of breath, more swelling, weight gain. At this point, you usually do not have to go to the hospital. This is something where you could bring in the extra fluid medication or whatever plan you have set up with your provider and go ahead and implement that here. And then when you get to the red, that's where you really need to be seen in the ER. That would be difficulty breathing. Even if you sit still, you know that shortness of breath is not going away, and chest pain or confusion. Those are all signs that you might need to go to the ER. So in summary, congestive heart failure is a very common condition. It is the leading cause of hospitalization in adults over 65 years of age. Those hospitalization rates do go up around the holidays. There's no cure, but symptoms can be managed. It's best if you stick to your routine and diet. monitor your symptoms very closely and have a plan if issues arise. And then, of course, call your doctor or seek medical care if things are not improving.
Thank you, Amanda. That was excellent. Some really good reminders as we move through November and into December. And now, Carole, we turn to you, and I'm sure a lot of that sounded familiar to you. And so if you don't mind sharing your story and some of your learnings.
Sure. Thank you, Mandy. So I'm going to start actually with talking a little bit about myself and how I got here. So starting in 2022, at the very end of 2022, I was walking from a parking lot into a concert, and I blacked out, fell backwards, hit my head. It was just out of the blue. It was so strange. Went to the ER. After some investigations, no heart attack, no clogged arteries. So they assumed I had a conduction disorder of the heart. So I, continued to do more studies. A couple months later, I developed a very low heart rate and got a pacemaker. That was supposed to be like fixed, right? Except about 7 weeks later, I had a lot of the symptoms that Amanda just talked about. I had a cough at night. I had shortness of breath, really very deep fatigue. I mean, I couldn't walk from one end of my house to the other without being out of breath. I felt sick. And so I had my husband take me to the ER because I had no idea. I tested for COVID. It was negative. I thought maybe I had pneumonia. I was shocked, quite frankly, when I was told I had heart failure. I'd been healthy up until the December before. And it was just, it was determined through an echocardiogram. They saw the cardiomyopathy, and I have a reduced ejection fraction of about 25%. I didn't quite understand what any of that meant. What I heard was the doctor telling me, "I'm sorry to give you bad news." And I was like, I was freaked. When I got a whole bunch of new medications, as you do, and I was sent home with some materials to read, some of that from Mended Hearts. I received a heart guide, which was very helpful. Sorry, I have some notes that I'm checking in on from time to time. So I read all I could, but I have to tell you, I was also very depressed, very anxious, very scared. And I ended up finding a psychologist who could work with me to help me get over some of that fear and find a way to reach a more positive outlook and to realize that I should, I could focus on what I can do. It's a lot. So I went from, feeling like I could die any minute to feeling, hopeful. Since my diagnosis back in April of 2023, I've developed ventricular tachycardia for a few days. I went through cardiac rehab. I got a different type of pacemaker. I now have a cardiac resynchronization therapy pacemaker and a defibrillator. So, I have more energy than I had before. Did I have a PET scan? Yes, I did, but that came later. And so I have more energy. People tell me I look good, and I always find that a little bit amusing and reassuring because I'm not sure what they think someone with heart failure should look like, but I'm glad I'm not that. And I'm glad to provide them with a different image, but I also will point out that looking good doesn't necessarily mean that I'm well. I've had several echoes since that first diagnosis. My EF has remained around 25%, much to the chagrin of my cardiologist. He thought it would have improved, but it has not. So I want to share with you what I do, and I'm sure this is what you've heard just from Amanda and what you do yourself, but I want to just provide from my perspective as a patient what I do. So, number one, I take my meds as prescribed. Faithfully, I have a timer set on my phone or an alarm set so I remember. I've a couple times forgotten for a few hours, but I always get them because they are critical to my well-being. I exercise every day. Now, I know that what I've read is, oh, exercise 3 days a week. That's not enough for me. I find I need to be doing something every day that I can. Every now and then I take a day off. And it's not a ton. I mean, I walk maybe, 40, 50 minutes, or I do aqua aerobics. I just did that this morning. I use my exercycle if the weather's not great. But what's amazing is when I was first diagnosed and when I had VTAC, I was lucky to do 10 minutes on level ground outside my house. That was all I could do, but I did it. And slowly over time, I worked up to being able to do longer level walks and then started incorporating some uphill. And I think that's a key part of actually fluid management is doing that exercise, keeping the heart as strong as it can be. I've reduced stress, although I struggle with that one. I weigh myself every day, and just like Amanda suggested, I have a scale that I take with me when I travel. I take my blood pressure cuff with me when I travel. I do check them every day. And my biggest challenge is the low sodium diet. It's not no sodium, it's low sodium. And 2,000 milligrams a day is kind of the recommended daily allowance for adults, but everybody gets more than that, right? So I'm now at the point I check out, going grocery shopping, I read the nutritional data on everything. It's shocking, some of the things that have sodium that you just didn't realize. Breads are pretty tricky. I've always been making my own bread, but every now and then I have to buy breads. And it's hard to find breads that are reasonably low in sodium. I just actually, since it's Thanksgiving, I looked up the stovetop stuffing mix, which I don't use, but, and you probably don't want to use it either. A half a cup of stuffing mix has 390 milligrams of sodium, which doesn't sound too bad, but then you add that on with all the other things you're going to eat at Thanksgiving, and who eats just half a cup? So it really, for all those things, you have to look at what's there. I cook with less salt. If a recipe calls for a full teaspoon of salt, I may put in 1/8 to 1/4. You still have a little bit of flavor, but it's okay. And what I also notice since I've been eating less sodium is that I taste the food, I taste all the different components of what I'm eating. And it tastes different, but not bad. It tastes, it just doesn't taste salty anymore. And I actually have discovered that I kind of like that. I discovered recently no sodium baking powder, which makes making like muffins and cornbread and biscuits safer. I make waffles with no sodium baking powder. I've always been making my own bread and my own tortillas. Tortillas are another one, by the way, that has a lot more sodium than you expect. It got me into a little trouble last Thanksgiving. Not the Thanksgiving dinner so much, but when going out to dinner or going out to lunch the next day. Getting to eating out is a huge challenge. I even had people tell me, you shouldn't eat out, just never eat out. And I'm like, I don't mind cooking, but I don't want to cook every day, every meal. I like to go out. So what I do, if I'm going to a chain restaurant, I look up the nutritional information on their website. I think they all have it, and it's worth checking it out to see what you can eat without going over your allotment. And for a meal, it's less than 2,000. It should be more, maybe 1,000, right? For a meal, one meal of the day. So I look up the chain restaurants. Now I got to also tell you that sometimes they have these charts and graphs that you can't actually read on your phone, or they're very hard to read on a phone, but it's still worth doing. For non-chain restaurants, and that's we like to go to local mom and pop restaurants, I will ask the server about low sodium items. Sometimes I would say, well, can you ask the cook or the chef? And they will do that. It's not always the best information, but you get a good idea. It doesn't hurt to ask. I eat a lot of salad when we eat out. I put the dressing on the side. I'm really aware and cautious. I eat some cheese, but a lot of salads when you eat out have cheese and croutons and meat. And some of the things that you can put on salads are fine, like a grilled salmon or grilled tuna. If you ask them to be prepared with no salt or no seasonings, that's good. Chicken, though, is a surpriser because when you're in a restaurant and you get chicken on a salad, it's often been marinated or I don't know what brined. I don't know what they're doing to it, but they're doing something. And it's not the low sodium item that it ought to be. I just looked up today because I got in trouble once with a Wendy's chicken salad. And I just looked up today, a Wendy's chicken salad has 2,000 or more milligrams of sodium if you eat all the toppings and the dressing. Yowza, that's a lot of sodium for one chicken salad. So, forewarned. At restaurants, I avoid soups. I don't ask for, I have them take the sauces off, the cheese off, the processed meats. I don't order pickles, capers, olives, all of that stuff. I just don't. Bread I have in moderation. I've been ordering, like I said, more salads, less sandwiches. That's how it goes. Reducing portion size is another way to reduce the salt. I love Thai food. And Thai food is a little high in sodium, but I eat half of what I used to. And that's worked okay for me. I put in my notes an added bonus is weight loss when you eat less and you eat healthier. I have lost a few pounds and I'm glad for that. Another challenge, and this kind of fits with Thanksgiving dinner as well, but potlucks. I go to a few potlucks. Sometimes Thanksgiving dinner is a potluck. What I end up doing is making something that I can take that I can eat. So I'm happy to share it. And then I don't know what people put in the other items that they bring. I'm somewhat cautious, but I do sample things. It's okay to have a few bites. That's fine. Just, you got to be careful. So if it looks like it would be really salty, I avoid it. But if it's a salad, even though it has dressing on it, you can have a little bit. It's okay. Thanksgiving dinner. So here's what I ran into last year. I had Thanksgiving dinner with a family member who ordered the whole meal from Whole Foods. So it's easy. You order the meal, you bring it in, it's just heated up and great. Fortunately, last year, I could go to the Whole Foods website and see how much sodium was in all the different ingredients of their prepared Thanksgiving dinners. And so I went and looked and saw that some things I could eat, some things I just had best avoid. Look at the portion size. So some things are fine, but you have to, watch the portion size. I checked a couple days ago and they don't have that information up this year, but I called them and they said it's going to be up soon. So if you're going somewhere where there's like a Whole Foods dinner or a supermarket dinner, it's worth seeing whether you can find the nutritional data of the different components. I did okay with Thanksgiving dinner last year because I was really careful. And pie, by the way, isn't too bad on sodium, especially if I make it. Then it's definitely good. Otherwise, if you're going to a dinner where the host is preparing it, there is no shame in asking about the sodium, asking about salt, asking them to use less. It's okay. And they don't have to make everything low salt, but if they make a few things that you can eat, that's very kind of them. And I think most people are happy to do that. Stay away from the brined turkey. I guess some people like to do that. You do not want to eat brined turkey. The other thing, because it fits with Thanksgiving, is travel. Because some people travel for Thanksgiving. I just have a couple thoughts where I've run into trouble. One is if I have to eat out more than one meal at a restaurant in a day, that's when I get into trouble. So I try not to. When we travel, like in the summertime, we go to like an Airbnb or we go to a VRBO and we get a kitchen so we can cook. We still eat out, but not more than once a day. And that has worked really well for us. Also, when we go to a hotel and they have, free breakfast included, yay, I take my own cereal. I get the coffee, they may have yogurt and they may have milk, but I bring my own cereal because there's really not a whole lot. Those waffle things, I wouldn't touch them. You don't even know. You don't know what's in them, so I just steer clear of them. So just a few final thoughts about this. People tell me I have a lot of discipline. And that may be true, but what I think about is how it felt that night I went to the ER with heart failure. It felt awful. I do not want to be there again if I can help it. Even when I get a little bit extra sodium and extra fluid and I start to be short of breath and I take a Lasix, but even that doesn't feel great. So I just find it's not that hard to have the discipline when you think about the consequences. Or as I tell people, necessity is the mother of discipline. So, you know, you do what you can. But the other thing, and this happened, I was talking with someone a while back, and they talked about having cheat days. The day that you just don't, you take a day off. Except my heart isn't taking a day off. My heart doesn't know about holidays. It just knows what it's doing every day, day in and day out, or what it isn't doing. And so I don't take cheat days. I really have to do this every day of my life, and that's okay. People have other disorders that they have to follow similar diet instructions, and so this is just one of those. The other thing I wanted to mention before I finish, and that is something I read early on that really has motivated me, and that is that people who did best following a diagnosis of heart failure were those who didn't give in and didn't give up. And so I really encourage everybody on this call, don't give in and don't give up. And that's all I had to say.
Oh, that was so wonderful. I had a smile on my face that entire presentation because what you said, I think probably really hit home for a lot of people. Thank you, Carole. So we do have some questions. And starting, I think this is probably more for you, Amanda, if you don't mind unmuting. If people don't have fluid buildup, so I guess for those people who don't often have to deal with it, why do people have to still limit their water and their salt?
Heart failure, it's just such a progressive disease. I've had patients who have gone years without any problems, but then much like Miss Carole, they end up in the ER suddenly with fluid on them. And I just think people don't realize how quickly it can build up on you within 24 hours. So it's best to prevent or then catch things early where they can be treated. So I think that's more of a prevention and getting in that mindset that this isn't going away. We want to always keep fluid under control, that kind of thing. Go ahead and establish those habits early on because that heart failure is going to stick with you chronically.
Thank you. I guess, Amanda, to that question a little bit is, can people with heart failure ever come off their medication?
Very rarely, I would say. And there have been some studies following patients whose heart failure recovered, like their ejection fraction got better, where we pulled them off of medications, or the people doing the studies would pull them off of medications, and a lot of times they would relapse back to heart failure. So, probably not.
Carole, Thomas is asking, how have your glucose levels been?
That's a good question. They've been a little bit high, but I've not had any of my physicians seem concerned about it. So just above normal, that's how mine have been. I do take Jardiance. I don't know if that helps or not, but I only take it for the heart failure. I'm not diabetic. But yeah, edging high. The other thing that edged high that was really surprised me was my red blood cell count. And I don't know, I was like, why? I never had a high red blood cell count. But then I was reading that one of the causes can be heart failure because you don't get as much oxygen, so you make more red blood cells. I thought that was fascinating.
Interesting.
Mm.
I'm gonna go, there's some comments I think that are more questions in the chat. Amanda, this might be for you or for both of you. Are compression socks recommended?
Usually they do help you want to make sure that it's okay with your provider, because sometimes they have to rule out things, make sure there's no blood clots or high potential for blood clots. But they do help with swelling. That compression helps mobilize that fluid, push it out of the tissue so it gets circulated better. So as long as you don't have a reason that you can't wear them, yes, they are recommended.
Thank you. Do you wear them, Carole?
I wear them on long airplane flights, but otherwise, no.
Amanda, could you answer what are normal measures for the BNP test?
So just a regular BNP is less than 100, pretty much rules out heart failure. It's not super specific in patients who are very morbidly obese. It may be a false negative. Sometimes at the hospital, they'll draw an NT pro BNP, which is a little more specific. And if that is less than 300, it pretty much rules out heart failure. So for a regular BNP, less than 100 is normal. For an NT pro BNP, it would be less than 300.
Thank you. Robin asks for you, Carole, do you feel the effects when you eat too much salt? Do you feel it soon after eating the salt? Do you notice it right away or?
No, no. I mean, usually I wouldn't feel anything till the next day. And sometimes what I see is just that I have had a few times when I've gained 2 pounds overnight, and I'll have a little shortness of breath and I will take a Lasix, but the symptoms are subtle. I would say they're subtle. I would say from what Amanda says, it's subtle until they're not. But I managed to nip it in the bud. I have stayed out of the ER for almost a full year.
You're going to do well these holidays coming up.
I don't know. It's the holidays. The holidays invite overeating, but I'm the host this year. So the good news is I'm well enough to actually fix the dinner and I can control the sodium.
That's great. That's great. Carole, I want to go back to something you were talking about before, and that's when you were feeling depressed and you went and you got help. Can you talk about the importance of doing that and not being afraid to go seek that assistance?
Yeah. Yeah. I mean, it was such a shock to have a diagnosis of heart failure. And it was depressing, tears, lots of tears were shed. And I had already been thinking of it, and then my primary care provider recommended that I find someone, a therapist of some sort. And I was very lucky, actually. I found a psychologist who took Medicare, like unheard of, but she helped me a lot. She had me do collages that let me focus on where I'd been at my worst, where I was at that point, and then how sort of visualize what success would look like. And it really just, she did other things that really helped me focus on the positive, focus on what I can do, and not dwell too much on all the things that I could no longer do. So it really helped tremendously. I recommend it.
Yeah, and John mentions therapy and support group is helpful. And to that point, I don't know if most of the people on the call know this, but we hold monthly heart failure support group meetings through Mended Hearts that are free. I believe it's the second Tuesday of every month at, I think, 5 p.m. Eastern.
It was today.
Was it today? Is today Tuesday?
Yep.
So yeah, so just a few hours ago, and people, you can go on to our website, the homepage, and you'll find the link to join. You don't even need to register. So it's a great support tool. One more question for Carole. Any tips on handling fatigue and anxiety when family events start happening and you just can't keep up maybe with some other people's energy levels?
Just don't. I mean, naps are really helpful. I find people are pretty understanding when I say I can't do those things that you're doing, and I'm not going to try because I shouldn't. And I generally find people are pretty understanding of that. Yeah, I mean, people want to go for a walk and I say, well, we're going to either go my pace or I'm not keeping up. I'm not going to try to keep up. So, you know, people are usually happy to go my pace. I have a pretty good pace these days, but for a while it was very slow going. So I don't know that that's how helpful that is, but
That's good advice. Just
mhm.
you do you.
You do you, absolutely.
So I don't see any other questions for right now. Amanda, do you have anything else you want to add before we finish up? Just last words of inspiration for people to get them through the next 6 weeks?
Just I don't know how inspiring, but the patients who do better long term are the ones who are able to keep themselves out of the hospital. Honestly, I see that very often. So if you can find a way to manage that diet or find a pattern that works for you, the less time you spend in the hospital, the longer you're going to live and the better your quality of life is going to be.
That's very fitting. Thank you. Carole, any last messages for the folks on the call tonight?
No, just, you know, do all the things you have to do. And I definitely concur, staying out of the ER is a good thing because it's really not a fun place to be. It just isn't. And my last time I was there I didn't have any, it turned out everything was fine. I actually got to go home that night. But it's just not a place you want to be. But if you have to, you definitely want to go there. So there is that. But yeah, just, you know, enjoy the holidays. The important part about your holidays is being around friends and family. It's less about what you eat or don't eat. So
Very fitting.
enjoy that time.
Well, thank you so much to both of you. This has been a great conversation, great education and information. And to everyone on the call, I hope your holiday season is safe and heart healthy and that no one ends up in the emergency room. So have a great evening, everyone, and we'll see you soon. Thank you.